I cannot provide medical advice. The information presented in this video is for educational and informational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or heard in this video. If you think you may have a medical emergency, call your doctor or emergency services immediately. Your health and well-being are important. It is important to consult with a healthcare professional for personalized guidance on exercises like Kegels, as they can provide tailored instructions and address any specific concerns or conditions. When it comes to maintaining and improving your health, seeking the advice of a healthcare professional is a crucial step. This is especially true for exercises like Kegels, which are designed to strengthen the pelvic floor muscles. These muscles play a vital role in supporting the bladder, bowel, and for women, the uterus. Strengthening them can help with issues such as urinary incontinence, pelvic organ prolapse, and even improve sexual health. However, like any exercise, it is essential to perform Kegels correctly to avoid potential harm and to ensure you are getting the maximum benefit. A healthcare professional, such as a doctor, physical therapist, or a specialized pelvic floor therapist, can provide you with personalized guidance. They can assess your individual needs and conditions and tailor the exercises specifically for you. This personalized approach is important because everyone's body is different, and what works for one person may not work for another. For instance, some people may need to focus on strengthening their pelvic floor muscles, while others may need to work on relaxing them. A healthcare professional can help you determine the right balance. Moreover, a healthcare professional can teach you the correct technique for performing Kegels. This is crucial because doing the exercises incorrectly can lead to further issues. For example, if you are not engaging the right muscles, you may not see any improvement, or worse, you could strain other muscles, leading to discomfort or pain. A professional can guide you through the process, ensuring you are performing the exercises correctly and effectively. In addition to teaching you the correct technique, a healthcare professional can also help you set realistic goals and track your progress. They can provide you with a structured plan, which can include the frequency and duration of the exercises and gradually increase the intensity as your muscles get stronger. This structured approach can help you stay motivated and committed to your exercise routine. Furthermore, consulting with a healthcare professional can help address any specific concerns or conditions you may have. For example, if you have a history of pelvic pain, a healthcare professional can modify the exercises to ensure they do not exacerbate your condition. They can also provide you with additional treatments or therapies if needed. This comprehensive approach can help you achieve better overall health and well-being. It is also important to note that Kegels are not suitable for everyone. For some people, particularly those with certain medical conditions, performing Kegels may not be recommended. A healthcare professional can evaluate your medical history and current health status to determine if Kegels are appropriate for you. If they are not, they can suggest alternative exercises or treatments that may be more suitable. In summary, consulting with a healthcare professional is essential for personalized guidance on exercises like Kegels. They can provide tailored instructions, address any specific concerns or conditions, teach you the correct technique, help you set realistic goals, and track your progress. This personalized approach can help you achieve the best possible results and improve your overall health and well-being. So, before starting any new exercise routine, make sure to consult with a healthcare professional to ensure you are on the right track. If you're interested in learning more about pelvic floor health, I recommend reaching out to a doctor or a pelvic floor therapist. Pelvic floor health is an essential aspect of overall well-being that often goes overlooked. The pelvic floor is a group of muscles that support the bladder, bowel, and for women, the uterus. These muscles play a crucial role in controlling bladder and bowel movements, as well as sexual function. When the pelvic floor muscles are weak or not functioning properly, it can lead to a variety of issues such as incontinence, pelvic pain, and even sexual dysfunction. Understanding the importance of pelvic floor health can help you take proactive steps to maintain or improve it. One of the first steps is to become aware of the symptoms that may indicate a problem with your pelvic floor. These symptoms can include a frequent need to urinate, difficulty in starting or stopping the flow of urine, pain during intercourse, and a feeling of heaviness or pressure in the pelvic area. If you experience any of these symptoms, It is important to seek medical advice. A doctor or a pelvic floor therapist can provide a thorough assessment to determine the health of your pelvic floor muscles. They may use a variety of techniques, including physical examinations and specialized tests, to diagnose any issues. Once a diagnosis is made, they can recommend a treatment plan tailored to your specific needs. This may include exercises to strengthen the pelvic floor muscles, lifestyle changes, and in some cases, medical or surgical interventions. Pelvic floor exercises, often referred to as Kegel exercises, are a common and effective way to strengthen these muscles. These exercises involve contracting and relaxing the pelvic floor muscles in a controlled manner. A pelvic floor therapist can guide you on how to perform these exercises correctly and ensure that you are targeting the right muscles. Consistency is key, and with regular practice, many people see significant improvements in their symptoms. In addition to exercises, there are other lifestyle changes that can support pelvic floor health. Maintaining a healthy weight, avoiding heavy lifting, and practicing good bathroom habits can all contribute to the well-being of your pelvic floor muscles. Staying hydrated and eating a balanced diet rich in fiber can also help prevent constipation, which can put additional strain on the pelvic floor. For women, pelvic floor health is particularly important during pregnancy and after childbirth. The weight of the baby and the process of giving birth can weaken the pelvic floor muscles, leading to issues such as incontinence. Pregnant women are often advised to start pelvic floor exercises early in their pregnancy and continue them postpartum to help restore muscle strength. Men can also benefit from paying attention to their pelvic floor health. Conditions such as prostate surgery or chronic coughing can weaken the pelvic floor muscles, leading to similar issues as those experienced by women. Pelvic floor exercises and other interventions can help men regain control and improve their quality of life. In conclusion, pelvic floor health is a vital component of overall health that deserves attention. By understanding the role of the pelvic floor muscles and recognizing the symptoms of dysfunction, you can take proactive steps to maintain or improve your pelvic floor health. Consulting with a doctor or a pelvic floor therapist is a valuable first step in this journey. They can provide the guidance and support needed to address any issues and help you achieve better pelvic floor health. Please like, share, and subscribe for more content on pelvic floor health.